Question number 2, hey Dr. Islam, why do you need to be on acid medications if you're taking a blood thinner? Yes, you do need to be on an acid medication if you are taking a blood thinner. This is one of the very few indications of being on a medication like Protonix or Acifex or Prilosec or medications just like this. Now, we have a very small indication of which patients need to be on these long-term acid medications, and one of them is being on a blood thinner. Why? Well, we know that blood thinners tend to not only thin up the blood, but have a chance of developing ulcers in that stomach, and that ulcer can cause symptoms of pain, nausea, poor appetite, and has a chance of either bleeding out or causing a tear in the GI tract. In fact, I've treated plenty of patients who've had ulcers in their GI tract from long-standing blood thinner medications. Let me know in the comments down below if that's somebody like you who's been on these medications long term. And one way that we know to protect the stomach lining or the GI lining is to put you on an acid medication. This has been shown in multiple clinical trials to be protective of the GI tract, to help prevent ulcers, prevent inflammation, and protect from long-standing issues. So yes, you do need to be on an acid medication if you take a blood thinner, and this is double whammy if you're on a steroid, maybe you're over 65, you've had a prior ulcer in the past. These are guidelines for us to help have a patient be on a acid medication. Great question.